A sinus infection can be disruptive to our lives, causing all kinds of aches and pains to the eyes, the forehead, even sometimes a throbbing headache. Back in March, Bev brought us this story of one sinusitis sufferer and how she found relief.
Chronic sinusitis occurs when your sinuses are swollen and inflamed for 3 months or longer, despite treatment. Chronic sinusitis can be brought on by an infection, by nasal polyps in the sinuses, or swelling of the lining of your sinuses. Symptoms can include nasal inflammation, thick discolored discharge from the nose, drainage down the back of the throat, nasal obstruction or congestion, pain, tenderness and swelling around your eyes, ears, cheeks, nose, or forehead, reduced senses of smell and taste. If you have had sinusitis a number of times and the condition doesn't respond to treatment, it may be time to talk to your doctor about other options. We spoke with Peg McClellan, a longtime sinusitis sufferer. She shared how she found relief from her chronic sinusitis with the help of Lake ear, nose, throat, and facial plastic surgery.
I was suffering with sinus problems for about 6 years. I had constant headaches. My left side of my neck hurt all the time, and I just didn't realize there was anything that could be done for it. It was just part of what I had to put up with. I was always taking antibiotics because about every 6 weeks I would have a sinus infection. I didn't want to go anywhere. I stayed home most of the time after work. There were certain stores, for example, perfume stores I couldn't go into because I would feel like I couldn't breathe, like I couldn't catch my breath because I couldn't breathe through my nose most of the time. I had just constant pressure right around the middle of my face and the top of my head.
People can know that they have sinusitis if they experience facial pressure and pain, purulent drainage, fever, congestion. It is not just an isolated incident. It's a pattern over time. If it occurs with changes in season, or if the patient can identify certain triggers that lead to it. The classic criteria is the Paradise criteria, which is more than 6 infections in 1 year, 5 or more over a 2-year span, or 3 or more over a 3-year span. But I also kind of base it off of how much it's interfering with their life and how much school they're having to miss, how much work they're having to miss. Also, we can tell on exam in the office by looking inside the nose.
I came into the office and we discussed the sinuplasty and that I was a candidate for it. Having the sinuplasty was probably one of the best decisions I've made. I had my surgery on Wednesday. I was back to work on Friday and feeling great. The chronic neck pain was gone within days. The raspy voice that I had had for years was gone, and I was able to sleep at night. And now I'm able to go outside. If I want to go someplace, I go to the stores. I'm able to enjoy going to the park with my grandchildren. And I'm very, very happy that I had this surgery.
For information on this story, as well as the links to the specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Sinuplasty Pegged story link on our homepage at yourhometownhealth.com.